If you're losing weight and noticing changes to your face, here's what we're going to think about. I'm Ginille, Cosmetic Nurse Practitioner since 2013. I went to Stanford, I went to Duke. I don't play around when it comes to your face. So very often with weight loss, either while you're in the weight loss journey or after you get to your weight loss goals, people will feel like their face is not as lifted. Everything looks like it's sinking. We are losing fat in our faces as well when we lose weight. So they will start to notice a line that kind of cuts from their under eye in through their cheek. They notice the smile lines look deeper, the corners of the mouth look deeper. This fat pad here keeps sinking and sinking, and then the jawline doesn't look very straight. They start noticing the jowls. They will also be losing volume through their temples. Under eyes look sunken and hollow. So it's really hard because they're working and wanted to get to the weight loss goals, or maybe they got to them, and then all of a sudden they're like, I was doing that to look and feel fresh, and my face is not matching my body, is not matching how I feel and healthy and renewed. So things we can do for weight loss in the face is, some things we can do are, filler. We can do traditional hyaluronic acid filler or calcium-based filler. We have different ones that we use in different parts of the face depending on what we're trying to treat, what areas of the face we are treating, what we're trying to achieve. So we might be doing some filler through the cheeks, into the smile lines, the corners of the mouth, the temples. We also may be doing collagen stimulators like PRF Easy Gel, the natural filler. So this is a filler alternative made entirely from your body's own growth factors and stem cells. With this, we draw blood from your arm, spin it in the centrifuge. It separates out growth factors, stem cells of yours, and nothing else is mixed inside of it. We take that, we heat it and cool it. After that, we will form a gel with it from heating and cooling it. It's thickened. We can place that anywhere in the face where you're noticing volume loss. Wherever we place it, your body's going to make new collagen over time. This is a gradual process, not an instant process. So you can do that. Or you can do something like Dilute Radiesse or Sculptra. These are other injectable forms of collagen stimulators that we can place in the face, just not underneath the eyes, into the lips, or into the nose. So what we're trying to do, and we will probably be doing this over a couple sessions, is restore that volume. We don't want to go too fast where things look overdone or overfilled. So I always tell patients, do some, let it settle, reassess your face. We can always do more. We can build on things. Okay. Hey Tiff, she said, or Timmy Jiff, what hotel would you recommend to stay in when we fly out to an appointment with you? Let me know. So we have offices in 3 different locations. We've got 2 in Los Angeles, Mar Vista and Torrance, and then we've got 1 in Las Vegas on the Summerlin side. Our Torrance office, there is a hotel that like you can walk 2 to 3 minutes from the office, and a lot of patients like to stay there. They'll stay overnight. They fly out, so that's something. Oh, in Vegas, I don't know Vegas. I live in LA, so when I go, I stay on the Strip at Fedara. It's non-smoking, so I like that one. I also like to stay at the Durango. That's off the Strip. It's about 20 minutes from our office. It's a casino, and it's like new for the people, for the locals is how they describe it. And there's nobody ever in there, but it's really clean because it's brand new and it's not super smoky. So I like that one. Thank you so much. So you're pretty. So yes, before you come into the office, we do virtual consults to go through your questions, your goals, tips on what to expect, how to prep for treatments. A lot of our patients are flying in, and I just want you to be prepared before we go into your appointment. We start building out your treatment plan on our virtual call. It's just nice because the patients come in and they're ready. We've already established rapport. We've already started talking about what I want you to do before and after your treatment. We make sure the dates, the timings are right for whatever you have going on in life. You might have, you know, you're getting ready for a birthday or a photo shoot or some big date. We don't want to do it too close to your events. And then we'll start talking about, okay, I'll see you at this date, and then probably follow up with you in a couple months so we can see you to do more if we need, or do your second skin treatment. So this is what we will go through during our call. Also, if you have done previous treatments, I want to get a lot of information from you about how those treatments were, what worked, what didn't work. Basically, why are you here now if you've done other treatments? So I want to go through your history. I want to help give you all the information. We're really big on having you make informed decisions, not rush decisions. We don't want to play around when it comes to your face. And so when I say we, I mean we have an entire team. So I'm Ginille. I've been doing this, like I said, since 2013. These are my 3 offices, JASI Skin and Wellness, but I also have I have providers in all of our offices that train directly with me, and they carry the same values that we have in our office. Coach Smith, I don't know how to do this. Hold on. Same values that I have. We focus on treating all skin types and tones. We focus on getting natural looking aesthetic results. We have relationships with our patients forever, forever, forever. It's not just, oh, we did use some Botox and see you never. No, we really want feedback from you. We want to learn more about what you like, anything that we can do better. The more we hear from you, the better we can tweak your treatment plan. Okay, let me see. 2 weeks, midnight. I can't wait to see you. Okay, I'm trying to scroll back. If there are questions, I don't want to miss them. If you have anything, throw them in the chat. I like to do the thing so we can go through all your questions. And you guys know sometimes a lot of them come in and then it gets hard for me because they start to go too fast. So I'm just scrolling to make sure I didn't miss anything. Scared to do Sculptra because it can't be dissolved. If you don't want to do Sculptra, do the PRF Easy Gel, the natural one. So that one is made from you. This is what I was talking about a little bit earlier. Safe for everybody. I've been doing the natural filler all over my face for over 2 years. I haven't had filler in my face for over 3 years. I've been doing the natural one because I'm breastfeeding a 2.5-year-old baby. My 2.5-year-old baby, but he is getting weaned. So I am very tired because this baby is mad and he is going down with a fight. So when you're breastfeeding, when you're pregnant, you can't do the treatments, but the natural one, since nothing else is mixed inside of it, that is what I've been doing on my face. This photo here is me when I had my first of 3 sons, and he's 11 now, and I had lost a lot of volume underneath my eyes. When we talk about weight loss that I was mentioning earlier and seeing changes in the face, I got really sunken underneath my eyes. I felt like my cheeks weren't looking as lifted. I really noticed a lot of volume loss into my temples. So after I finished breastfeeding, the first thing I did was put filler in my face. Because I just felt like I was sunken in my face and I looked like I had hi Justice, hope you're doing so good, had no fat in my face. So I did filler, and then I did that same thing with my second baby. I feed them all for 2 to 2.5 years. And then now this last one, instead of waiting the whole time and getting super, sunken, I've been doing the natural filler over the last couple of years. And I feel like I have not gone back to that, which is really nice for me. I'm 38 years old. I'll be 39 this year. The natural filler, again, takes time. It is not instant, but I can definitely see, I don't feel so self-conscious. I know what it's like when I'm feeding this big toddler baby and he's eating chicken nuggets at the same time. I know what it's like to lose fat in the face. I know what it's like to look sunken. And I don't feel so sunken this time. So this one definitely works. If you don't want to do Sculptra as a collagen stimulator, do the natural filler. Anybody can do it. Again, I always tell patients, younger, healthier patients are going to have better outcomes. This does depend on your body making new collagen. It can take up to 6 months to see the full effect from the natural filler. That is how long it can take to make new collagen. Some people will receive results faster than others. Justice, you're so sweet. So with this in the arts, I appreciate you. But really consider that one. And a lot of our patients are doing natural filler and regular filler and skin treatments. And we might be doing these things in different parts of the face. Okay, I'm going to see if I missed any. Okay, 6 weeks in with Sculptra, now at the back to normal stage, thinking about getting threads. Hey, Felicia, thoughts? I don't love threads. If you do threads, I'm like, just go to somebody who does them all the time and can show you faces that look like you and show you results and like what it's supposed to look like 2 months out, 6 months out, not just the immediate. I know there's a lot of threads. They'll put it in and they show you the immediate after. I don't care about that. I'm like, you're swollen. I want to see it once it settles. So that's my biggest thing there. Felicia, I felt like I had not seen really good results in the industry, and the industry is pretty like divided on if they work or if they don't work. And hearing so much feedback from patients that have done them, like I had some people like, I think it worked, or I don't really know, or it was a complete waste. And I don't like to do treatments like, if I do something, I stand behind it. I need to be able to get the results consistently, and I need to be able to achieve the results in different ages, different races, and different types of faces, thin faces, full faces. And I feel like I hadn't seen that with the threads. In results that I had seen of providers, like of colleagues that I'm like, oh, I like their thread results. They also had done threads and a lot of other stuff. I'm like, dang, I can achieve that with what I got already. So for me, I'm not super a fan, but check that out if you are. Just like I said, really do your research. You guys know I'm always here saying don't rush with your face. Don't trust anybody with your face. I'm like, even with me, like a lot of people before they come in, they're like, I've been watching you for years. I'm like, great, that's perfect. I want that. And like, ask me all the questions. We're not here to like do fast things. I don't want people, if they're just like, I just want to do this now. I'm like, let's hold on. Let's talk through this all. We don't want to just overdo anything. Okay. User 317 says, I'm scheduling a consult. I'm in Richmond, Virginia. Depending on treatment, what is typically touch-up time? Skin treatments, we're going to be doing about a month out. If it is your natural filler, between 1 to 2 months for your second treatment. If it is traditional filler, that's where you're going to get your instant result. I'll see you about 6 to 8 weeks out. So anywhere from like 2 months-ish is going to be around the time that you're going to be coming back, especially for people out of town, right? But how many times? Because technically sculpture would be cheaper. Don't go off price, guys. That is not, do not make your decisions just off price. I know. I don't want to be here on there saying like, I know it's a consideration for people, but make the decisions on your face about the right treatments for you in that moment based off your goals. Don't go off price. When people start doing stuff based off price, that's when they mess up. For us in our office, and we have all of our pricing online, we can give you a better like idea of pricing specific to you once we talk. But all of my fillers, they're the same price. All of our Botox, our Dysport, our Xeomin, it's the same price. Everything, my skin treatments are the same price, because I have worked in offices in the past before I went on my own. I've been on my own since 21. Or not my own, I have my team now. But like in the other offices, oh gosh, every syringe would have a different price. Every skin treatment would have a different price. Every Botox had a different price. And then the patients would come to me, I'd be making this recommendation and say, I think this product is going to be best for you. And they're like, oh, but this one is cheaper, $50 cheaper. I want to save that. And I'm like, that's not what's going to serve you. So don't go off a price. Go off just what you want to achieve. Talk to your provider about your goals is the biggest thing, and like what they recommend for you. Don't make it off price, guys. Other things, when people come in for me to fix stuff, which happens a lot, and I'm like, dang, like, why are you here? Like, what is going on? They're like, dude, I hear this all the time. I wanted to go to you, but I went to this girl and it was cheaper, or I just wanted to get it done really fast. I couldn't get in with you. And then they're coming to me to fix it. I'm like, go back to them. Like, they'll fix it for you for free. And they're like, I don't want to deal with them. They mess me up. I don't trust them at all. I'd rather pay you to fix it and then redo it than like go back to that person. And I get it, but like also the mental like space that you have to go through to like, dang, like I'm not in love with this. It takes a little bit of time for it to settle. Like, now you got to go through this. I don't love it. You're waiting for 1 to 2 months for it to chill out. I'm like, don't go off price. Don't rush on your face. Don't go off price. Do your research on who you want to treat your face. Have an active voice in your treatment plan. My patients know, I'm like, I have so many questions before I can decide what we're going to do. Before, I can look at your face and say, I think this would work. But before I can do that, I got to ask like 50 questions to decide. Because what I may be thinking may be something you like about your face, or you could have tried that product that I'm thinking and you didn't like it, or whatever. There's so many considerations. So price is not it. We also have financing for people. So if you want to break it up into payment plans, we have that. It's through Cherry. You can pre-qualify before you come in. So some people are like, okay, I qualify for $10,000. I qualify for $5,000. So they can use that. And then, they'll do that and they might do their treatments and might say, okay, I'm going to re-qualify for Cherry later on in a few more months. But don't make your decisions off of product, for the price. Sorry, guys. I've been talking for 20 minutes for one question. I just really want to stress that. And who you see and not rushing it in a time frame. Okay. Sorry, girl. I'm not yelling at you. I'm just yelling in general, not at nobody. Okay. How many times do I have to do jawline filler? I got some, but it didn't really make much of a difference. Lucy. So when people tell me they got stuff and it didn't make much of a difference, I got like 50 follow-up questions. Okay. So my thing would be, how much did you do? Is going to be the first and foremost question. Jawlines in general, it's going to take like 3 to 4 syringes. When I'm doing this, so a lot of times people be like, I was talking to my virtual consults today. She's like, I did a half syringe in my chin. I'm like, that's almost making the situation worse than if you just didn't do it at all. If you do too little, you guys, you're going to feel like you didn't see a result. because it's just not enough product to make a change. If you have a fuller face, thicker skin, deeper bone, a lot of people of color, or anybody with a full face, I'm like, it takes more and you need the right product. So this is why you gotta go to somebody that understands these products. I'm not yelling at y'all. I'm just on here. I'm not trying to have attitude. You gotta go to somebody that understands the products. A lot of these providers, and I love them, these are my colleagues and stuff. A lot of people are like, I'm a trainer for this product. When they're like a trainer and they're only the trainer for one product, guess what? They get best pricing on that product. And so they're gonna use that product primarily on your face. And that product may not be the best product for you. And again, the way I talk about it, I'm like, we treat all skin types and tones. The reason I say that, guys, not all faces are created equally. And so a lot of injectors, if they don't treat diverse faces, they don't really know what products to use to like get the result. It's every freaking week I'm talking to women of color that are like, I went somewhere, I tried someone's saying it to me right now. I tried something, I didn't see much difference. When I'm like, how much did you do? Either they didn't do enough or it wasn't the right product. I'm like, yeah, you didn't see it with that product. That product's too soft. In my mind, I'm like, I know that provider picked that product because it's freaking cheap and they're going to get a better dollar on it. They're going to make more money on it. And I'll be like, tell me more about like that provider and who they see. And when they start describing like what the provider looks like, who they see in their office, I'm like, yeah, but you don't match like that demographic of patients that they see primarily. And so why'd you go there? Like, oh, I don't know, because it was next door and I got a discount on it. So that's just what I would say. It could be that you need more and it could be too soft of a product. These products have different properties. Sorry, I'm like taking my jacket off. I'm not mad, guys. I'm not mad. I'm just trying to stress this. I just feel bad because I know the patients don't know. I get it. You don't know. Like if I walked into a car shop and they were trying to tell me which tire to get, I'd be like, I don't know, just get the cheapest one. Like you don't know. So you really got to go to somebody. Again, I'm like, vet your provider. Look at their before and after photos. See faces that look like you and read their reviews. Have a consult with them. Do not rush deciding who's going to touch your face. You got to see people that look like you on their patient before and afters. You need to, so when people come in, they come in, we got thousands of photos, and thank you, Jesus, and thank you to my patients who have allowed us to use their photos, because I'm like, if it weren't for my patients, people wouldn't be able to see. So I'm like, I don't care if you're a 67-year-old white woman. I don't care if you're a 20-year-old black girl. I don't care if you're a 45-year-old Asian girl. I'm like, I'm gonna pull somebody up that looks like you. And men, same. But this is like, shout out to my patients again, because if it weren't for them, I'm like, how would other people be able to see themselves in this? Also, our results are natural. Go to the top of my page. Look at the first pin post, or look at like the little series. You can see through different ones: under eye filler, nose filler, facial balancing. You can see different patients. So this is, again, thank you to our patients for like letting us educate. The work looks natural. If you see these people walking on the street, you're not going to think she got a bunch of Botox and filler in her face. You're not going to think that. And dang, she's been doing skin treatments for a year. You're not going to think that. You're going to be like, oh, what kind of makeup is she using? What kind of skincare is she using? Like, we're doing the things, and she's not wearing makeup. That's the whole point. So anyway, sorry. I'm not yelling, guys. I'm not. There's 48 messages. I'm trying to scroll back. I'm trying. Okay. Okay. I have a turkey neck from weight loss. Is there anything that other than surgery that can work for that? If it is a lot of excess skin, surgery is going to be the best option. If it is mild and it's not just like super, super hangy, try Botox into the neck bands, platysmal bands. That'll help. Oh gosh, I don't have Botox, guys. I don't have Botox and filler because of the baby. But Botox in through here will help tighten along the jawline. Every time I do it to people, they always come back. I do that again. Do more this time. It helps to give some tightening. If it is a lot of loose skin, only surgery is going to be the best. Other consideration is something called dilute radius. That'll give a little bit of improvement into like for collagen stimulation for the laxity of the neck. Skin tightening devices, I don't advise. I've worked with several of them in my other offices, and I felt like with the skin tightening devices, it was just like the patients, it was another thing. I think I see a change, or I didn't see a change, or it made it worse. It was too variable. I don't need variable responses from my patients. I need consistent, yes, this works, yes, I love it, and that's what I stand behind. Like, those are the treatments that I do. So I have not seen any skin tightening devices in aesthetics. I've been in this since 2013. I have worked with multiple devices and on different faces, and I wouldn't do non-surgical. Midnight, have I done Botox? Yes, I've done Botox. I just need some because I'm breastfeeding. So that's why I'm just walking around. I've done Botox for my frown lines, forehead lines, around my eyes, the bunny lines. I've done the chin dimpling. I like that. Into the neck bands. I like that. Other places you can Botox. I've also done my masseters for TMJ symptoms, teeth clenching, headaches, grinding, jaw pain, my temporalis muscles for the same. Those are both chewing muscles, TMJ symptoms. Those are the muscles we're going to treat. You can do Botox for hyperhidrosis, excessive sweating underneath the arms, into the palms of the hands, into the soles of the feet. Botox for my patients in their calves to help slim the calves. I've done Botox for excessive sweating in somebody's groin, and not somebody's, a few people's groins. So Botox can go a lot of places. Into the traps if you feel really tight up here, into the neck for pain. So I've Botox like the whole faces of the bodies, and I've done Botox all over my face. It's just been some time. Okay, what do you think about nose contouring with fillers? Cupcake, I love it. Guys, these people probably might be off this call by now because I'm going back to the top and I'm going to try to get them all. Nose filler, I love. Look at my pin post on there. But with nose filler, we can camouflage a bump on the nose, lift the tip of the nose, help minimize the asymmetries on the nose. We can work on the nostrils to make, either the shaping more triangular, more circular, more round. We can create a highlight down the center of the nose so it looks more contoured. So we can do a lot with nose filler. These are all things you'll be able to see immediately with the results. There's no downtime with it. You might be a little swollen, maybe bruised. It is very rare for me to see somebody bruised on the nose. I do it over 2 sessions. We do some, let it settle. We build on that foundation 6 to 8 weeks later. I don't think it's good if you have a really, really wide nose and you want a thin nose. I will say that's not going to be the best for you. That is going to be where you do, that's where you're going to be working with, like doing a surgical thing or get a surgical consult. But we can do a lot with noses. I have all different faces, men and women, and different races and different ages of noses on our page. Again, thank you, Jesus, and thank you to our patients who have allowed us to share their before and afters, the ones that have consented. I just appreciate it so people can see themselves. I've heard so many people, I'm an Indian woman. I've never seen somebody else that looks like me. I've never seen somebody else that has the same bump as me till I came to your page. I didn't know I could do something about it without having to go through surgery. So I hear that a lot. So again, thank you to the patients for sharing. The safety with filler that we always want to talk about. When we're doing filler anywhere in your face, what we want to make sure is that we don't block blood flow off. We got different blood vessels running through our full face and our full body. We don't want to put too much filler in any spot that it blocks blood from moving. So when we're injecting, we want to make sure that you don't have any extreme pain. You don't have any vision issues. Your skin color is normal. If you had any signs that it could somehow mean that we're blocking blood flow off, the good thing is you can break down the filler. So in our office, we carry, it's called hyaluronidase or Hylenex to dissolve the filler. We can dissolve the filler, break it down really fast. That is so great that we have that. We have all these like emergency protocols and oxygen delivering device and oxygen, like all these things for emergencies. Thank you, God. We've never had to use them ever in any emergent situation. I've never had to dissolve anybody, any part of their face, any filler for any emergency. And I've been doing it since 2013. So very rare, but that's what we're being careful of. These things are medical treatments. So I'm always like, make sure you're seeing somebody that is a medical provider and is licensed to do these treatments. Make sure they have the things to intervene in case of an emergency. Make sure they know what to look for in case of an emergency. Make sure they educate you on what to look for. So all the things. Sorry guys, I feel like I'm hollering. I'm not yelling. I want you to know these things before you do anything on your face. Okay. I'm scrolling back. Fozzie, I hope you're doing so well. Okay, we can drive home, right? It won't be too much swelling. You can drive home. Yes. Yes, you can drive home after you finish your treatments. You should be fine. And people will also ask, can I do all these treatments in one day? They're like, can I do my Botox and my filler and my natural filler, and can I do my skin treatments? And yes, you can. Majority of the patients that are coming in, you guys see, people are coming in. Every time I'm in clinic, somebody has flown in, and this is why we do our consults before you come in. But they're coming in and they're doing multiple parts of their face. They're doing their skin treatments. They're not just doing injectables. We have developed the plan before they come in. So yes, you can do all of these things. If there's a limitation, I'm like, hey, I can't put filler and the natural filler in the same spot on the same day, I'll let you know. But in general, they're going to be able to do their chemical peel, their laser on the same day as they do their natural filler underneath their eyes, maybe their filler in through their mid face or their temples or their lips and their lower face, and then their Botox for their frown, forehead lines, and into their neck. So we can do all of those things. Oh, and I haven't even gotten started on talking about dang hair treatments, and we have a whole wellness program. So you can do these treatments, but this is why we'll talk. And also, this is why we do things over time. There's a lot of these things I'm like, I need it to settle. I need you to give me feedback. I need to reassess your face. Then we can go. Then we can like build on this. When we do this stuff, like I said, we do a treatment plan. You can bruise, you can swell. I need to be able, not just me, my team, we need to be able to see you once it settles, because if I'm poking you, I'm like, oh, you might bruise. If you're bruised, it's going to lift the skin a little bit more. And then I'm going to think, oh, this is raised. And so I'm going to think the cheek is lifted or the under eye is lifted, but really it's just a bruise. So that's why we say, let it settle. We're going to come back and look at it again in 6 to 8 weeks. I would love for you to never be bruised and to have no swelling, and I can have the perfect result in one tray. And like sometimes, there's a lot of times we get that because the patients do their pre-care beforehand. But I want the patients to expect to bruise and swell. So you're not like, oh, no, if you come in and you're like, don't bruise me. I'm like, dude, I can't do it. Like, I realistically can't do it. There are so many blood vessels in your face. Yeah. And there's a lot of times the patients don't bruise. However, I don't want you coming in thinking I'm just not going to be bruising. It's going to be fine. I want you to expect the worst. It's really, the patients are always mad at me. Like, Ginille, you hype this up like it's going to be such a big deal, and it's really not that big of a deal. I'm like, I know. But you're happy, right? You're happy that it's not a big deal. Better than if it was a big deal and I told you it's not for me anything. Okay, now it says 75 messages, guys. So I'm going to go to the bottom, and then I'm going to try to keep going up. I live in Texas. I would like to see you. How soon after the treatment would I have to go back? I ask if you're doing filler to stay in town for a day. Remember I was talking about those emergent things I want to look out for. Stay in town for 24 hours. Make sure you're cool, and then you can go. I've never had to, again, intervene. I've never had to call, a provider in another state and say, help my patient out. But this is what I'm looking for before we send them off. Before you leave the clinic, I'm doing all the skin checks. I'm showing you what to look for. We're in so much communication with you. So thank you. Can my lip lumps still delete themselves after 6 weeks? You're gorgeous. Hey, Jess, thank you so much. I hope you're doing so great. Filler in the lips, or filler anywhere. I tell people, I'm like, it's going to take 6 to 8 weeks to fully settle. If you see little bumps, I'm like, they'll chill. Give it 6 to 8 weeks. Now, I don't know, Jess, if it was somewhere else. Like, I know the products that we use in our office, they settle nice. It depends on the product that was used in your face. The old school products that I just don't use in my office, but a lot of people will use because they're cheap and they can get better profits off of them. I just don't use them because a lot of them leave bumps. Like, the technology has improved over the last 5 to maybe 8 years. And so I don't even buy the old school stuff. I don't care how freaking cheap it is and how much profit I can make off of it. I'm like, I'm not making profit. I'm having to go back and see the patient again and dissolve it and fix it. So I need to do things right the first time. I need to do things right every single time. So I don't know what product you have, but give it 6 to 8 weeks. If we saw you at our office, I'm like, it'll chill because I know what products we use. Okay. Let me see. How many rounds of the natural filler would you recommend for smile lines to see good results? Depends on your age. Depends on how deep the lines are. I would say 2 to 3 are going to be cool. If you're like young and they're not that deep, do 2. But if you're mid-30s plus, I'm like, do 3. Stack them back to back. Then let it sit for a minute. Let that collagen build. It can take up to 6 months. I would give it 2 to 3, 4 months, before you start to decide if you want to do something else. If it is not doing enough for you, if you want more lift, come in and you can do regular filler. I would say the mid 60s is where people will come in and they start telling me, girl, I'm an old lady. Just do the regular filler. I'm tired of waiting. So that's just something to keep in mind. Okay. Crystal said, I love the brutal honesty. I know. And you guys are only going to catch me if you see me in person or if you see me on live, that I'm going to be saying all the things. It's too hard to put into a 30-second video. People won't get it. And you see, for me to answer one question, I got to explain for 5 to 10 minutes. There's a lot of thought that goes behind each and everything that we do. My patients know this because they are in the office with me and they see me forever and ever. And I'm talking it all through. I'm not going to do anything without explaining all of this, they're probably like, shut up. I have people sometimes like, just shut up and do what you want to do. I hear what you're saying, but I'm not listening. There's like, we trust you and go. But I'm like, I know, but I want you to understand like what's going on. Yeah. And like what's going on specific to your face in this moment and why this today and da 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 da. And then if you think I talk a lot, look at our freaking notes. It's like everything is written out. Our whole team is like that, guys. They're just so thorough and they care so much. And yeah, anyway. Okay. Let me see. Do you do hair treatment for alopecia? Yes, we do in our office. Let me talk about the hair program. What about double chin? Okay, so we have a whole entire hair health program. We have a Black dermatology nurse practitioner on our team, Niani. I like to say she's Black because there's not a lot of Black derm NPs out there. She's amazing. She really helped to lead this program as well. So in our office, we have a scalp detox facial. With this, we are trying to cleanse the follicles. We don't want the follicles being built up, having buildup on them. Sweat, product, oil buildup. We need to clean that out. So we're trying to clean that out. After we do that, then we're doing the PRF injection. So we draw blood from your arm, spin it in the spinner. It separates your growth factors, your stem cells. We inject that where you're noticing hair loss. We also have red light therapy that we do during that whole treatment, and we do like a little scalp massage, so people like that part. We get you started with the right supplements. We like the Nutrafol supplements and recommend those. If you guys want those, text my team. The price they give to the provider offices is cheaper than what you get even on Amazon and on their website. So we get them started on Nutrafol. If they want to start prescription medications, sometimes we're doing topical and or oral medications. Depending on how severe the hair loss is, we might be doing this for longer than as people, if they're like, I'm just starting to see it. If you're just starting to see it, I'm like, that's when to start. Don't go when it's like, dang, the hair is really, I'm bald. Like, it's hard to do at that point. Other things to keep in mind, we want to talk about the triggers for whatever's going on. If it's traction alopecia, meaning like from pulling at the hair scalp, from braids, weaves, whatever, we want to minimize whatever the triggers are for the hair loss as much as we can. So we talk a lot through this during your consult. But yeah, come see Niani too. She's amazing. And Vanessa loves doing all the hair stuff. If there's a med spa that doesn't have Hylenex, I give them the side eye all day. Girl, I don't know what is going on in these streets. There's some crazy stuff. People do a lot of illegal stuff in these medical spaces, and it's very sad. I have heard the craziest stories over my time of being this, where people were like, can you do something? I have something in my butt that can you take it down? I'm like, what is it? They're like, I don't know. She just had it in these red cups. I was like, what does that mean? They're like, the red cups, like the drinking cups. She just had it, and then she's like, put it inside me. I'm like, there's nothing that comes in red cups. Everything is sterile. What do you mean? She's like, well, I just did it in my friend's backyard. I'm like, I've heard these stories that you would think are insane, but I've heard it multiple times over. My lips, it feels like cement, like rocks. I know what filler feels like. I'm like, oh, that's filler. I can dissolve it. I'm like, dude, this is cemented rock in your lips. I don't know what I can do. Like, can you dissolve it? I'm like, we can try, but I don't think it's going to go down. Why? What's happening? Go see your provider. She fled the country. I'm like, what? Okay, well, why'd you do that? And they're like, well, it was $50. It was $200. I'm like, nothing I even purchased is $200. My own cost, nothing. Dude, she was making a profit off that, so she probably got it for $5, and it was actual cement. And you have rocks in your face now. And now you gotta go I've seen people in these comments tell me, they're like, I work in plastic surgery. We can't fix them either. So I'm like, please, guys, I'm not hollering and yelling. You guys probably know I'm insane. I just want you to know all the thoughts in my head and what I see, and it's sad, and people are doing stuff that's illegal, and people are practicing without license, and no, you don't want that. We got to understand what's going on in your face. It's not just chasing a line. I got to understand the anatomy and what's happening. I got to know what to look for, not just me and my team. We got to know what to look for to keep you safe. That's the first thing. Safe is safety. Especially, I see a lot of people of color on my page. I'm like, y'all, there's a lot of considerations we have to take with the face, especially being as a person of color, especially because I read the clinical trials that come with each product that we carry, and I read the studies. I'm like, how many Black people are in there? How many Latin people are in there? How many Asian people are in there? And the numbers are very low. And so I'm like, they're not even really studying these products in skin of color. I got to think about all of that before I just decide to am I going to bring this on and try this in my face and try this in my family's faces and my friends' faces, and then come out here and then tell a patient to come and do it. I don't think every provider, I know every provider's not doing that. So anyway, you guys know I'm hollering. What is wrong with me tonight? I think I'm about to start my cycle. What, a luteal phase or something? What is it? I see it on TikTok all the time. Okay. Doesn't filler migrate. If you're not if you follow your dang pre and post care, you're going to be good. If you don't rush your filler, see somebody who knows what they're doing. They're using the right products in the right place. You got to be the right candidate for whatever filler is happening in your face. So this is why you got to go to somebody that can like vet and make sure that you're going to be the right candidate for it. And then follow the post care. I tell people, don't manipulate it. Don't rub it. You're going to move it. So you're going to be fine. I've had filler all over my face. My patients, I do the full face. Like all my patients, look at their faces, look at their reviews. People are always tagging me in their photos on here and I need to like share them. Like look at it. Guys, I wouldn't even have time to be like on here talking and making as much dang videos as I do if I was trying to fix all my patients because I was doing a bad job. Like, no, I wouldn't. And I got 3 kids and I got a husband and he's doing his oral surgery and he's running around and I've got 3 practices. Like we got to do stuff the right way every single time, period. So that means I can't be like playing around with people's faces and giving them half behind results. No, it needs to be freaking perfect every time. Sorry, I'm yelling. Okay. What do you think about Dr. Lipo shots? I don't know what that is. I'm ready. You're in Vegas too? Yes, we're in Vegas. We're in Los Angeles, not in Georgia. But I see patients every time I'm in clinic from out of state. So every single day. How do you cure smile lines without cheek filler? Jatoria. Okay, so when it comes to smile lines, I'll talk to smile lines because everybody thinks about this. It's going to be a 5-minute lecture, so sit down. So when it comes to smile lines, people will notice these lines getting deeper and they want to just treat them. And I tell people, I'm like, it's not just the line here that is deep. Maybe. But majority of the time, people start noticing these lines get deeper over time. So we get older and or if they change weight. If we lose weight, we start losing volume in our face. Everything starts to sink down. And so then they're noticing the lines look deep like that. So they want to just take some filler and fill it. And you can walk into a random med spa for Groupon and they'll put filler right there for you. But then this is going to be puffy. And then this is going to be saggy. And then you're going to have these puffed out lines. It's going to look wrong. So when we're doing the face, I tell everybody, we're not here to spot treat. We're assessing your full face from every angle. I'm thinking about my team. We're thinking about what's going on underneath the skin. Where are you losing volume? Where are you losing bone? I know we lose bone here as we get older. It starts to sit back. So this is going to be the deepest part of the smile line. We lose bone on our chin. Like these are the things that we have to consider before we just start putting filler. So you don't have to put it in your cheeks if your cheeks already look nice and lifted and have a pretty highlight. And you don't have to do any of it, but you might mess yourself up if you just do your smile lines and the cheeks look saggy. If you don't want to do filler, you can do the natural filler. PRF Easy Gel, like it's the one made from you. You can also do Dilute Radiesse or Sculptra. Those are collagen stimulators. When it comes to smile lines, don't overfill, don't rush it. Think about the rest of the face, not just the line. I promise you this line is caused from something else. So think about all those things and when I say don't overfill, I don't try to chase to get that line all the way gone. When people do that, they look bad and then it looks bad. And you just don't want to look bad. Do you want to look natural or do you want to look like you've done weird work? We don't want it to look like you've done anything, but look at the patients. They look fresh. Look at my patients. They look good. They look like themselves. I just posted a lady. She has sent me some beautiful photos and she was like, why didn't you post my pictures last time? And I was like, oh, I need to see them. I need to check them. So we want it to look fresh. We want it to be like people can't tell that you've done something. They don't know. They can tell you look fresh, but they don't know. They're not going to say, oh, you did smile line filler. They can't tell what it is because we did the whole thing. And the freaking skin needs to be the best thing. So, okay. I'm not yelling at you. I promise. Okay. Going. Open eye and lift brow without drooping wrist. See the right provider. So this muscle around the eye is a circle and it closes in like this. When we Botox here, instead of it closing, gosh, I got all the muscle movement. Instead of it closing in so tight, it'll help give a little bit of lift. It's not like crazy. It's not like that, but it does make the eyes look a little bit more open and it softens the crow's feet if you want, depending on the placement. So that's the biggest thing when you're saying without the drooping wrist. Anything you do, there's always a risk for an outcome that we aren't trying, unintended outcome, but you're going to minimize that risk for the unintended outcome if you're seeing a provider who knows what they're doing, who knows how to do the right dose, who knows placement. So that's why I'm like, take your time when it comes to your face. Don't just do somebody random. Okay. I had a Nefertiti lift. I had a Nefertiti lift 5 days ago, 30 units, and I hardly feel it. When does it kick in? Xeomin. So when you do Botox, Dysport, Xeomin, all of these are going to be your muscle relaxers. You know, they're going to help fine lines fine lines here, the horizontal lines, the crow's feet. She did it into the neck. Nefertiti lift is into the neck to help tighten along the neck bands. It can take 2 weeks for the full effect of your Botox, your Dysport, your Xeomin. So you're only 5 days in. 30 units might not be enough. Like it can take like 60 units to really like see a difference in the neck. I usually say 40 to 60. And I tell people if I'm starting them at 40, I'm like, hey, we're starting this like medium dose. This is not like, we can do more. So it could just take a little bit long. It could take more units. And also you can't make your full assessment right now. Give it the 2 weeks. After 2 weeks, if you're like, I don't see change, or it's not enough, just talk to your provider, do more, and just know you can do more. You don't want to be too crazy in the neck. If you do too much, it can feel kind of bobbleheady. If you place it right here, it can feel hard to swallow. So you gotta, I don't know if they're just trying to be conservative. I don't know if it was a budget thing, all these things. Okay, we talked about what I think about liquid rhinoplasty, so the non-surgical nose job. I love that. With nose filler, we can camouflage a bump, lift the tip of the nose, create a highlight down the center so the nose looks more contoured. We can minimize asymmetries. We can make the nostril shaping either more round, more triangle. Patients love that, and you can do it. We do it in 2 sessions. We do some, let it settle, 6 to 8 weeks, build on that initial foundation. I tell patients it lasts 1.5 years to 2 years. A lot of people will come back to 2 years later and it's still perfectly straight. And they're like, should we do more? I'm like, no, it's perfect. Like, what are we going to do? So it's really nice. And there's no, you could bruise or swell, but I don't really see bruising there. Swelling is very minimal. Patients really love that one. See somebody, sorry, I'm not yelling at you, girl. See somebody that knows what they're doing. The blood vessels in the nose run behind the eye. So it is what we consider a higher risk area to inject. You don't want to be shoving a bunch of filler in there and they do something and they got to dissolve it. And then all of a sudden you're like, oh shoot, they don't have the dissolver. So you already know I've been yelling all night. Sorry. Corey, we are in Los Angeles. We're in Mar Vista, so outside of Culver City, and we're in Torrance in the beach cities. And then in Vegas, we're on the Summerlin side. Do you have photos of our work all over my page? You can go to the pin page. We have thousands of photos. So we have thousands of patients that have consented to share their photos. I have, on the top of my page, I have one video of me talking about the clinic and what we do and what we stand for. It's just kind of flipping through patient pictures. We have series. I have series and you can go through there. I think there's one on nose filler, under eye filler, facial balancing. It's me talking through photos like this, like, hey, this is a patient. She came in for X, Y, and Z, and this is what we did. I actually need to add the video I did today to that series. And then there's a lot of patients that have made their own videos about their experience and tagged me, and I just need to repost them. So, but yes, we do have photos. Also, reader reviews. My name is Ginille. I'm a cosmetic nurse practitioner since 2013. I went to Stanford. I went to Duke. My clinic is JASI Skin and Wellness. We were under the name Ginille Beauty Aesthetics. So we just switched the name at the end of last year. So you can look up Ginille Beauty or you can look up JASI Skin and Wellness and you can read reviews there, hundreds of reviews. Again, thank you to our patients for sharing their experiences so other people can learn about it and see themselves in this. We treat a lot of all skin types, all skin tones, all ages. We see men, women, we see everybody. I'm transgender, I'm transitioning. We see all the faces. If you got a face, I can do it, period. The biggest thing is we got to talk to you about your goals, all the things, assess your face and build out a treatment plan specific to you. So this is what I do. I really love it. I cannot turn my brain off from this, guys. I try, I'm like, this was not what I ever intended to do with my life. I had no desire. I had no even knowledge that this was a thing. Somebody offered me this job 13 years ago. I don't even know. I was like, what? She was like, you should take it. Everybody wants to get in this. And I was like, I still don't even know what you're saying. These words to me, I've never heard. Restylane and Juvederm. This sounds like a foreign language to me. And then I went and shadowed this nurse practitioner and I was like, oh, I thought it was going to be like these crazy looking things you see on the TV and people looking weird. And I was like, this is regular people here. And she's like, yeah. And then I was talking to the people about why they were doing it. I'm like, why are you even getting whatever this is? This is toxin, Botox. And they were saying why they do it and how it makes them feel and really seeing the human side behind it. I was like, oh, this is pretty cool. It's just regular women just being vulnerable about how they feel and how the treatments make them feel and all that. And I was like, oh, this is pretty cool. And so I took it and And then if I do something, guys, I gotta do it 5 million, bajillion, infinity% to the fullest. And I really liked it. I was also working part-time as a family nurse practitioner. And I like that too, but like, I was like loving this. And so then I just put all of my effort into it. All of my money was going into like going to trainings. Everything was just to like learn and like do better and do better. And like, if I wasn't having a patient, I'd be in the room with another provider that was doing their patient. Or if there would be a rep there, I'd be sitting there asking about the clinical trials. Like, I wanted to learn so much. And it's still how I feel about it. I don't even know, nobody even asked me this. But I absolutely love it. I can't turn my brain off from it. I go to sleep and I'm like thinking about it and dreaming about it. And like, yeah, I'm very grateful. I'm like, this is only God's plan. I did not plan to do this at all. I never, ever, I don't even wear makeup. Like my mom didn't let me do it. So like, I didn't know this whole thing, and I love it now. And so, yeah, and JASI, my clinic name, JASI, I made that up in 2021 for our skin line, JASI Skin. I forgot to link the products. I forget to do that stuff. And you can get them on the top of my page though. JASI Skin. And I did that. My middle name is Jasmine. And so I was like, oh, Jasmine, Jasmin. My mom calls me my middle name. And so I was like, JASI. I just made it up. And then this year, we changed this, we were at the end of last year, we changed the name over to JASI Skin and Wellness for the whole clinic, because I'm like, this is not Ginille Beauty Aesthetics anymore. I was just intending for me to see my patients, but now we have a whole team. I was not intending to bring providers along, but like, freaking, they're awesome and they're so great and the patients love them and they're fully booked. But anyway, I had patients ask me, what's JASI? I was like, there's no cool story behind it. It's just like my middle name. And then I was like, I guess we need to make a video about like what JASI stands for. And one of the girls that helps me film videos, she's like, there's gotta be like a meaning behind it. I was like, there's no meaning, it's my name. And then she looked it up and she typed it in and she was like, oh, JASI on Google, it says it's derived from Hebrew and it means he saves, like God saves and like God heals. And I was like, oh shoot, like God has been in this the whole time. It's only his plan for me to do this. I pray all day, like, God, send me who I need to see when I need to see them. Let me make sure they feel beautiful without me and Botox and none of this. Like, I want them to feel beautiful and love themselves the way you love them and the way you see them. And what I do, you guys, go so much deeper beyond Botox and filler. I love Botox. I love filler. I'm gonna do this until my hands get chopped off. Like, I love it. But I'm like, it's the connections that I have with the patients and hearing their stories, and it's so much like life behind it. It's not just me doing the pokes. Also, I feel like I'm so grateful for the community I've built online. And I know I can't see every patient in the world, period. I get it. Like, people all over the world, but I'm like, I want you to make informed decisions. Like, if I can help make a video and it saves you from doing a bad decision. I've seen people comment on there. There was a video the other day. I said, don't do IPL if you're black. Intense pulse light, you're going to burn your skin off. And a lady wrote on there, she was like, oh my gosh, thank you. I just canceled my appointment because you said this. I had no idea. I'm like, that woman would have been burned. So I know a lot. I want you to know a lot. I want you to feel beautiful without Botox and filler, because you are beautiful without it. If you decide to do these skin treatments and all that, I freaking love them. And I'm like, we do them. We're going to do them safe. We're going to get you a good result, period. Anyway, nobody even asked me that question. I don't know what the question was. I appreciate you. Oh, do you have photos of your work? that was the question. I was trying to say, go read the reviews. I don't even know, but I appreciate you guys being here. I'm trying to scroll. How long does Botox last? Botox lasts it depends on your dose. So the more you do, the longer it lasts, the more frozen it is. So most people are getting like 3 to 4 months out of it, but I have some people I can get up close to a year to last, but we do a lot. And I have some people, I'm in acting or I'm a therapist and I need to frown at people still. I don't want you to do that much, do baby Botox. And we just do a little bit and it wears off faster, like 2 months. So, okay. Nicole, how long to wait after getting traditional filler before getting fat transfer or plasma filler? Wait at least 8 weeks, so at least 2 months before you decide to do that. Okay, how long jawline filler? I've done it once. When should I go again? Lucy, if you did your filler and you like your results, give it 1.5 years, 2 years before you add more to it, at least. Like, you'll see the effects kind of fade. If you did it and you're like, I don't really see much, or I want to make it sharper, or I want to make it more defined, give it 6 to 8 weeks before you add more filler into the same area. Okay. Let's see. Okay. Sorry, guys, I've been hollering. It says 86 messages, and I'm still trying to get through the other 75 that I didn't get through. Do you recommend electrolysis or laser hair removal? Hair removal, I like a lot. You can do it a lot quicker. As long as the hair is dark, it's going to do well. If your hair is blonde, silver, the laser won't pick it up. So that's when I recommend people to do electrolysis. And people like electrolysis too. It is a little bit more painful, and you got to go one by one with the hair. We don't do it in our office. I am treating a girl right now, and she's getting it, and she's like really pigmented on her face and like each follicle. And I'm like, girl, it's like every little dot. I'm like, oh, this is rough. So just depends on what's going on. Okay. Lucy, I have half a syringe of filler in my lips. I did it twice. Should I get more? It's a bit plumped, but I still feel small. Lucy, hard to know without seeing you. When it comes to lip filler, here's some things. I do half syringe on a lot of my patients, probably majority of my patients, before we do a full syringe. But we use a thicker product. Like, it depends on the product you're using. If you're using a half syringe of a thin product, I'm like, you're not going to see a change. I get it. Also, it depends on what your baseline is. If your lips are naturally full, you might not see too much change. If you have really thin lips, a half syringe can make a big difference. So there's a lot of considerations here. The other thing, before you just start doing lips, remember, we're not here to only spot treat. I say this all the time. We're not just spot treating. We got to consider the surrounding areas. So you want to make sure you don't do your lips and then your chin is set back and your lips are jutting past your chin. It's going to look not great from your side profile. It's going to look what people call ducky. So you want to be mindful of that. You also want to be careful that, let me not mark on myself, if you don't want to have like juicy lips and then the sad corners down here, that's going to look bad. So we got to think about the whole surrounding area. We want to make sure the lips have the proper framing around them. Yeah, you want to have like these deep shadows here. Like these areas should also be treated. So those are some considerations before you just do lips. It depends on your age. Somebody older, if they're having more shadowing, that's when I'm like, hey, we want to really, really think about this. But again, you don't want to do too much and your lips are jutting past. So hard to know, Lucy, without like being able to completely see you. Foster said, come, let's show her love. I appreciate you. Thank you so much. Okay. Felicia said, 6 weeks in with Sculptra, now at the back to normal stage, thinking about I did that one. Okay, so 92 messages. Let's go down. Okay. Do we offer biofillers like Renuva? No, we don't do that in my office right now. We do PRF Easy Gel. So that one is made entirely from your own body's growth factors and stem cells. So that could be one that you can like. Your body is going to make new collagen in those areas over time. Leticia, I love my skin, but I want to try microneedling and Easy Gel. Want to look less tired. Around how much? Okay. In our office, I haven't even telling y'all nothing. We have a skin membership program. I need to do these with my team. They might keep me focused. We have a skin membership program. We have a skin membership program. We have a hair membership program. We have a weight loss and wellness program. So a body program. In our skin membership, patients come in on a monthly basis and they do one of our skin treatments. So we've got Aerolase laser, safe for all skin types. Anything I talk about, safe for all skin types, all skin tones. There's no downtime with this. It's going to treat acne, fine lines, pores, texture, dark spots. I really love this one for acne, redness. I like that one. And hair removal. I think that does like really stand out for the Aerolase. We also have skin pin microneedling, good for texture, acne scars, collagen stimulation. That's where I think that's a standout. We have Bio Refill Chemical Peel. I love this, period. I love this for brightening of the skin, smoothing the texture. And then we have Hydrofacial, deep cleansing of the pores, hydrating the skin. So you pick one of our core skin treatments for the month. That covers your monthly session. Most of our patients are stacking on. So our monthly, it's $3.99 for the month, and you pick one of those 4 treatments. If you want to a lot of our patients are going to do 2 or 3 treatments in the same thing. So they might be doing the laser followed by the microneedling and the peel all in one. Or it might be the laser followed by the peel and the Hydrofacial all in one. Most of our patients are combining these. When we combine treatments, we're working on different layers in the skin. You're able to get your results faster. So that's what our patients like. Everything safe for all skin types and skin tones. So that is our skin membership. When you stack them on, so if you wanted to do a second one, it's $250. If you want to do a third one, it's another $250. If you want to do your face, neck, and chest, do these areas. Bring it down, guys. You don't want just your face looking great and your neck and chest not matching. It's $250. So we try to make the pricing straightforward. I don't want to say, oh, get the peel, it's $50 less. And then if you do no, the pricing is easy. Like, I don't want you to make your decisions off of the price, off of this is $50 and this is going to be $100. I want us to choose the right treatment for you in that moment. And a lot of patients like it because they're like, oh, I want to try this one and I want to try this one. And then I want to stack them and I want to see whichever. I like this favorite. If you ask our team, everybody has their different favorite stack. My favorite stack is doing the laser, the peel, and the hydrofacial. A lot of my team loves doing the skin pin. I do the microneedling the least amount only because I got these babies and like you got to be really clean on your skin for 48 hours. My babies have their feet and their hands and my face all the time. Like, get out of here, you little germy babies. I love them so much. And you just got to, like, for 48 hours. And I wear a mask in the clinic and, like, I get itchy. So, I don't like the microneedling as much because of that little bit of downtime. Most of my team, that's, like, their favorite thing. Actually, everybody loves a peel, too. So, anyway, we can look at your skin. We can decide what treatment you're doing in that month, and it flexes. You know, I had a guy come in the other day and he was like, I'm here for my pill. But when we started talking through it, he's like, I'm super dry right now. I've been in Vegas on a vacation for the last week. I'm so dehydrated. So I was like, I don't know if the peel is the right thing for you. Actually, right now, the right thing for you that's going to serve you best is going to be the hydrofacial. So we pivoted and we switched this treatment up for that day. Again, stacking them, patients love it. You can do these treatments full body. So we have people doing hair removal. We have people doing, treating pigment and scars on their body. You can do these all over. And again, safe for all skin types, all skin tones. Look at our team. We got all colors of the rainbow. We got everybody, and look at our patients. We got all colors of the rainbow. We do these treatments safely on all skin types and tones. But that's how much it is. $3.99 in the membership. If you want to do them as a single session, I think it's $550, or we have packages of 4. I think it's $2,000 for a package of 4. So we price them, it's a 6-month membership minimum. We price them because we want you to get the results. Doing a one standalone, I'm like, you can do it, but that's not like going to get the result. And 4 is mostly from when we have people coming in from out of town and they're not there in on a monthly basis. And so usually they're like, hey, I'm going to come in quarterly, or when I come in twice a year, I'm going to do my 2 treatments combined and 2 treatments combined. So we have these things. We try to make it very easy for you. And was there something else you want to? Oh, Easy Gel is $2,550, and that covers 2 sessions. In the skin membership, it's $950 a session. Okay. Someone said, what kind of water is that? This is just regular water, but it's just filtered. We have some purified thing. It's something extra, alkaline water, something like that. Kia, okay, I need help with my hollow under eyes. So if you're hollow underneath your eyes, sunken, feeling like you have volume loss underneath your eyes, that's when we're going to use either filler or the natural filler to help lift the volume and minimize the sunkenness volume loss. You can only do filler underneath your eyes if you're a candidate. To be a candidate, you cannot be somebody who gets puffy underneath their eyes. If you say, I wake up, I'm puffy, not a candidate. If you cry a lot, not a candidate. You got bad allergies, not a candidate. Anybody that retains a lot of water by their eyes, not a candidate. Filler binds water. So if you tell me I'm puffy every day, I'm like, oh, great. If I put filler there, it's going to be puffing up and down and up and down. It's going to look horrible. It looks so bad. And you guys have probably seen it and just been like, oh, they look botched. It does look botched. They just were probably not the right candidate for it. So you want to make sure you're the right candidate for filler. If we do filler, do it in 2 sessions. Do some, let it chill. 6 to 8 weeks later, we can come back. We can add more if we need to. You can bruise, you can swell. I tell people it lasts 1.5 years to 2 years. Most patients get way longer. I only did under eye filler once. After that, I just have done the natural filler these past couple of years. It lasts a long time. But because it lasts a long time, you better see somebody who knows what they're doing and is going to get you the dang result and can show you eyes that look like you. Period. Okay, the natural filler made from your body's growth factors, your stem cells, a simple blood draw. Your body's going to make new collagen in this area over time. This is not instant. This is going to take time. This will improve over time. The healthier, the younger you are, the better the outcomes. Okay, those are that. Limitations with under eye filler. We cannot take away the fat pads. We all have fat pads underneath our eyes. Some people just stick out more than others. If you got that fat pad that bulges, only surgery takes it out or tightens it. What we can do is bring the skin up around it And so we can hide the fat pad. So that is something you can do. We cannot change the color of the skin. I mean, look at me, guys. I got access to all these treatments. I still have darker under eye skin. And so I tell people, I'm like, you know, if they're just like, my skin is dark, I'm like, if I just can't change it, you know, but can you prescribe me a bleaching cream? I'm like, sure, I'll do it. And then they're like, it didn't do anything. I'm like, I know, it's the color of your skin. Like, just leave it alone. If I put freaking makeup, I will only put a little boop of concealer there. But people will tell me after doing filler is they'll be like, hey, like, I know you said it wouldn't change the color of the skin, but like, it looks brighter though. I'm like, it looks brighter because it's not sunk in. So like us lifting it, light reflects off the face a little bit different. It's not catching a shadow from being sunk in. And so, or they'll tell me, oh, ever since you did that, now I can put concealer on and my concealer actually conceals. Where prior to doing filler, I'd be trying to put my concealer and it looked bad. It just looks sunken and dark. So those are things to think about when it comes to under eye filler. Okay. What happened if you got stripes or lines on your forehead after microneedling? Rocky. When was this? And did you follow pre and post care? What needle depths were they doing? What were they putting on? There's like a lot of things that we need to know. What device were they using? Really, guys, when it comes down to it, you doing your part is going to be a big deal, period. Because that's going to be the most that you can control is who you pick to see, and then follow that pre and post care. So avoiding the sun, don't scratch at the skin during your healing your healing time. Don't put on active, like anything that makes you itchy. Like you guys think I talk a lot here. Imagine if I see you in person, and imagine my team. Goodness gracious, the team talks just as much. The appointments, they're not all day, but like it's thorough. It is very thorough. So I don't know what happened there. There could be a lot there. Can you get Aerolase if you're on tretinoin or hydroquinone? Hey, Austin. Yes, you can, but you have to stop it before you come in. We stop it about a week before and then stay out of the sun. Austin probably gone. He asked that question 30 minutes ago, probably. Okay, what did you do for your eye bags? I did filler, and then I have maintained it with a natural filler the last couple of years. We talked through under eye recommendations for Belle. Okay, I think I got them. What degree did you have to do to get this to do this FNP? I am a family nurse practitioner. I went to Duke for my bachelor's in nursing and my master's in nursing. I went to Stanford for my undergrad degrees in human biology and comparative studies in race and ethnicity. So basically ethnic studies. Okay. These people, you guys are, did I work at Laserway? No, I did not. Okay. Let me, not saying anything bad about Laserway, but I did not work there. Okay, what it said, I want to prevent. Let me see. Okay, if I had to pick from PRP or Botox, what would you recommend? I'm 45 and I have no wrinkles. Okay, 40, you might be gone, girl. You want to prevent, you have no wrinkles. At home, if you're already looking and feeling good about yourself, I would just keep doing your sunscreen and using your retinoid. Those are the main two things. At home, your skincare, you can also do red light therapy. You got to do it a lot. That's something you can do. PRP, I do the easy gel, not just regular PRP. So remember, we take your PRP and your PRF, and then we heat and cool it. So doing that thickens it into a gel. It helps hold the growth factors and stem cells in the skin longer. So I would say doing that is good for like areas of volume loss, and like these common areas are going to be the under eyes, under the cheeks, the smile lines, the corners of the mouth. Those are areas I would think about doing. And yeah, the under eyes is a big one. The natural filler, if you're noticing volume loss, if you feel like you're expressive and you're like getting, I mean, you guys see my face, I'm just making all the faces, lines through here, through there, that's what I would say. Botox before lines get etched in on the skin. So they're different, they're just different. You probably will end up doing both. Most people are doing both of those. Okay. I'm going to speak it into existence, Jenna, that you will eventually have a med spa in DMV. Girl, I mean, this is all God's plan, so I don't know. I just am just like, none of this was my plan, and I didn't even want to do any of this. I'm like, here we are. We're in Torrance. We are off Hawthorne and Torrance Boulevard. So we have 3 suites in Salon Republic there. I want to have like a standalone office in the South Bay. But even for me to find my clinic in both in Vegas and in Mar Vista, it takes like a year and a half to like find a space, build it out. The salon suite, it's nice. We have them like connecting rooms. and we have got our space. I'm able to do what I need to do. And I was able to do it in like 3 weeks. So that was way nice. Okay. Did I balance my face? Can you balance a face with Easy Gel? Yes, I have a lot of patients that will choose to only do the natural filler for whatever reason. They're not candidates for it, or they're just like, I don't ever want to do filler, and you can totally do that. And they'll do their full face with it. Under eyes, temples, cheeks, smile lines, lips, here. When we do that, when we're treating like multiple areas, typically we draw 2 tubes. When we do like all those spots, we'll draw 4 tubes of blood. And so then we have more to treat in different parts of the face. Your beautiful hearts of the Filipino. Hey, Priscilla. Yes, I'm Filipino black. Yes, I'm Filipino. Oh, they didn't even know. I know. I be thinking people know. Okay. My under eyes are starting to look a little sunk in. What can I do for that? Natural filler or regular filler? Tom's mom. I schedule my consults. I cannot wait to see you. Okay, guys, we do the consults. Go through your questions, goals, tips on what to expect, how to prep for treatments. I'm not the only one that does them. Do it with the team. Samantha, she's excellent. She's been doing some of the lives with me. Everybody's like, oh, I want to just see Ginille. It's because you guys know me because I've been making the videos. I'm like, my team is excellent. Samantha is so thorough. She's probably freaking more thorough than me. You think I talk a lot. She talks a lot. But like the stuff she says is just on point, and the patients love her. I've had multiple patients be like, I was going to see Ginille, but now I'm going to reroute my flight to Vegas instead, and I'm going to see Samantha. You will love her. Come check her out. Haley said, come to Florida. I was really trying to do a spa. Okay, the spots that I was trying to get before Vegas was Texas and then in Florida. We were in Florida a lot because I take my kids on cruises a lot. And so I'm always there. And I have a lot of patients from there, and it's diverse. I like diverse places. And New York is like probably the other one that we see the most from. So those 3, they're just a little far. And then there was things with like, oh, the rules in Florida are a little different, and in Texas. I was like, gosh, I don't have time for this. Let me get another clinic. So anyway, okay. Let me see. You guys, I'm sorry. I've been hollering, and I'm not meaning to be yelling at people. I'll be in Los Angeles. Can you do a consult and treatment same day or within a few days? Nick, possibly, but I'm telling you the best thing is to like virtual at the very least. At the very least, you know, here and there somebody will message me, and I'll be voice messaging them back and forth. And if I can see your pictures and say, this is what we're going to do, yes. But really, I don't know. You could be in here, like people are coming to LA and they're like, I'm going to be on the red carpet. I'm like, I can't do anything to you right now. So I just need to know more and make sure the timing is right. I just don't want people showing up and they're like, oh, I can't do anything. Like this is not worth that. So set up some time to consult, at least send pictures to the team, chat with Samantha, and we'll tell you if realistically we can start building that treatment plan. We want you to do the pre-care before you come in. When you do the pre-care, the patients heal better and they're not bruised up, they're not all beat up because they were able to like do their part before they came in. So even if you cannot catch one with me, because I know people are always like, oh, you're always booked. I try, guys. I even did virtual consults today, and I never do it Saturdays because my Saturdays are like filled with going to basketball and fencing and baseball and piano lessons. This is what I'm like, what the heck? But chat with Samantha. She's excellent, and she and I'm in communication with like everybody on my team all day, every day. So okay. How long does the national I think you mean the natural filler. How long does the natural filler last? Okay, so natural filler, with that, when your body's going to make new collagen can last, I say 1 to 2 years, like up to 2 years. The healthier you are, the better the outcome. So not heavy smoking, drinking, drugging, healthy diet, like all that is going to have a better environment to make new collagen and maintain new collagen. Using your sunscreen, like if you're doing all those things, poor diet, heavy sun exposure, smoking all the time, that stuff is like breaking down collagen faster than it needs to be. So it's just hard. I'm like, it's going to depend on the person. I will say most people that are coming in to do these treatments, they're in this whole like, I'm already taking care of myself, you know, like they're typically healthy, and so they have great outcomes, but it is something that we want to be mindful of. Would you recommend natural filler first? Depends on what's going on. Like it really depends on when we do your consult and like what your goals are. People, you know, I had talked to somebody the other day and she was like all gung-ho. She was like, I'm going to do natural filler. I was like, okay, cool. We went through all these things. And she's like, I only want to do natural filler. I was like, great. And then I was like, what events do you have coming up? She's like, my birthday's in April. I was like, whoa, like all the stuff you're talking about, your results, like they might not be there by April. So she's like, but I want to like look so fresh for this birthday party of mine. I'm like, I can guarantee a little bit more result over with filler because I can pick and choose which one and how much lift. The natural one, I'm waiting for your body to make collagen. So if you're feeling sunken now, you might not have the lift you want in 2 months. It might take longer. So then she was like, oh, let's pivot. I actually want to do something because I need to see the lift. So it's us talking through what's going on. It's really like, how fast do you want to see the results? How much volume loss is there? Your age, again, your health and your lifestyle is a big part of it. If somebody wants something where it's like more contoured, like I really want like a more contoured cheek or more contoured chiseled jawline, that, or in the nose, like those are when I'm like, hey, I need to use like a sturdy filler to create that. And like the natural filler is not going to give me that same structure. So that might be when I make the recommendation. So it really just depends on you, what's going on, understanding all the things around it. I'm not one here to be like, oh my God, I love natural filler, straight up. I love them all, guys. I've done them all. But I've done multiple sessions of the natural filler, and I've done, it took time. When I very first did it, I was like, I don't see any change. That was stupid. Because I'm used to putting filler and like seeing an instant lift. I was like, I don't see anything. But it got better over time. And like, I was like, really? Oh, wow. Like, I'm like, dang, I like it a lot. But I've just been on this time restriction with feeding that baby, so I can't do regular filler. I love it. But if you want a fast result, that's when we're going to be using filler. Okay. I'm trying to scroll back. How do I get rid of my smile lines? I mean, I've been doing that natural filler. I haven't done regular filler in those. And I still have smile lines. Guys. I'm moving my face. Like, this is something to keep in mind. They're not gone, and I'm not trying to chase them to go all the way gone. Hey, oh, hi, Eternal Peace. I hope you're doing so great. I made some posts about you, and I think you're so beautiful, and thank you for sharing your pictures. Okay. I think I got him. I just got mastered Botox at your location today. Desi, oh, I don't know who you saw. Maybe you saw Ashley or Niani, and I love them both. There's no playing favorites on this team because every girl is excellent. Like, when I'm around them, when we're around each other, it's just so fun. The team gets along so well and supports each other so well, but like really everybody there for the patient, like the support for the patient, which is, we're so excited that you're here. And if you have questions anytime, I tell every person, I'm like, just message us. Like, we see everything that goes through. I see every message that goes through. So like, whatever you need, it's not just when you're in clinic talking to us, like whatever you need, call us, text us, we're there for you. So I'm so excited. Okay. My corners are turned down from my lip lift. I need to see it. Sometimes it's putting like a little filler into the lateral part of the lips, or it could be doing some Botox into the right here. It could be doing some filler into the marionette lines or the natural filler. So yeah. Okay. With the members, since it's a 6-month commitment, does that mean you pay up front? You do not have to pay up front for the membership, so it's a monthly, but there is, I think you save like, it's either 5 or 10% if you do pay up front. And so a lot of people are like they basically get like a free treatment if they pay up front, but you don't have to. And they'll be like, put that on Sherry, the financing thing. And I'm like, wow, that price is really good. So you can do that if you'd like. Okay. Should someone get PRF Easy Gel while losing weight? You can totally do that. Okay, so weight loss. If you're losing weight, I started this live talking about that. If you're losing weight, if you're noticing changes in the face during your weight loss journey, or you've lost weight, that's when we can do regular filler for instant result, or we can do PRF Easy Gel, the natural filler for the collagen stimulation, or you can do collagen stimulators that are not made from you, like Dilute Radiesse or Sculptra, to make new collagen. So those are all options. I find a lot of patients like to do something while they're in their weight loss journey and not wait till they get all the way down. I think doing the collagen stimulator is nice because it's going to be better than being completely volume deficit. Sometimes I tell people like, hey, you're going to lose another 20 pounds. Do you want to wait till you get to your goal, or do you want to do it now? And most of the time they're like, I don't like the way this looks right now. Like, I want to do something, like, why do I want it to look worse to start doing something? Like, let's do something now. We just know if you're continuing on a weight loss journey that we're going to reassess your face when you get to those goals. Okay. But I think you'll like it. Let me see. I think I got them. What is facial balance? I'm going to do like a few more questions. I say that and then I keep staying on. I need to go see these kids and put them to bed. What is facial balancing? Do you recommend for face puffiness? If your face is puffy, I mean, that's hard. If your face is puffy, I got to talk through more with you. What's causing you to be puffy? What areas of the face is being puffy? I got to know a little bit more. Facial balancing is when we're using filler or natural filler, collagen stimulators, Botox, your skin treatments, all these things that we offer in the office to help you look refreshed. It is really us assessing your full face from all the angles. We want to make sure your features, nothing is like dominating. We don't want just, you know, a lot of people in aesthetics will I just want to do my lips only, lips, and they got big lips and everybody sees it and it looks bad and their chin is set back and it's just not good. Or they only do their smile lines and their smile lines are puffy and their cheeks are down. So facial balancing is us looking at the full picture. We're making sure that your face looks harmonized between your features, like upper and lower face. So it's us thinking about the full thing. And we might be very likely are doing a combination of skin treatments and, you know, injectables, cosmetic injectables, or a natural filler to help you just look balanced and refreshed. I made a post today about a patient and you can see, and she has done skin treatments and filler and Botox and natural filler all in her face, and you can see, and she's 61 and she came up in here, and I'm not going to call her out. I don't know if she wanted to call her out, but she sent her pictures and she looks good. And she was like, I said, I'm going to make a video on these, and she's like, go make it. So you can just see, like, that is when we're thinking about facial balancing. It's the full face. We're not just here spot treating. I think a lot of injectors and a lot of patients think in isolation. They just think my smile lines look bad, my lips look small, and they're only thinking about one or two places. And I'm like, it's not just one or two places on your face that are aging or that are changing over time. We got to think about the full thing. I am thinking about my team. What we are thinking about is underneath the skin, where you're losing volume, where fat pads are separating, where we lose bone. So we inject in that way. We inject like what y'all don't see on the surface of the skin. So that's why our patients look natural. And we're considering the full face. We're not here to just spot treat. Okay. Okay. Wish you're in Virginia. Okay, guys, I'm going to go. Yes, you can do it with the natural filler. You can do facial balancing with the natural filler. It just will likely take more. And remember, it's not quick. And there's certain limitations with it, you know. Like I said earlier, if you want to have really contoured cheeks, I can't get the same structure with the natural filler as I can with certain fillers. So it's something to think about. Okay. If you have more questions, I'm going to try to do. I'm so grateful I got to be on here today. I've been doing pretty good about getting on here. I'm trying to do it more with the team so you guys can see the rest of them, because it's not just me. But call us, text us, set up your virtual consults. The number on the page, the team helps me with answering those. These girls have been with me for years. Like, these girls hear me and they know the deal, and I see everything that goes through. But let us know anything there. We'll start building out your treatment plan. We make sure you're prepped before your appointment. Our patients come in, they're making informed decisions, not rushed decisions. This is very intentional, very well thought out whenever we do anything on your face. You can watch a lot of stuff on my page. I say a lot of the same things, guys. I'm not here to like say one thing here and then do something in office and say something different. And the team is saying the same thing, because this is what we stand behind. This is how we get the results. This is what the patients read the reviews, look at the patient pictures. Like, yes. Fazia, I appreciate you so much. And thank you. I know you've been on here watching for a while. God bless you guys. I hope you guys have a great night. I will save this and I'll post this on the page too. If you need anything, let us know. Thank you so much. Good night, guys. God bless.